You know that nagging pain in your shoulder? The one that starts out as just a little thing and then, before you know it, it's a real frustrating problem? Well, today we're going to pull back the curtain on one of the most common causes, supraspinatus impingement. Let's dive right in. We've all been there, right? You reach up into the cupboard for a mug, maybe you're just putting on your coat, and bam, this sharp pinching feeling right on top of your shoulder. It's super common, and yeah, it actually has a name. So that pinch is officially called shoulder impingement. All it really means is that a key tendon in your shoulder, part of that famous rotator cuff, is getting squeezed in a space that's just too tight. It's not some mystery pain, it's a straight-up mechanical issue. All right, so here's our game plan. First, we're going to look at that pinch point up close. Then, we'll introduce you to the specific muscle that's at the center of all this and figure out what's causing the trouble. After that, we'll walk through how it's diagnosed and how to find relief, and we'll wrap up with a solid home recovery plan you can get started on. First things first, let's get a really clear picture of what's actually going on deep inside your shoulder when you feel that pinch. The absolute best way to think about this is with a simple analogy. Just picture your tendon as a rope, and the space in your shoulder joint, that's a really tight, bony tunnel. Every single time you lift your arm, that rope has to slide through the tunnel. If that tunnel is too narrow for any reason, the rope gets squished, it gets irritated, and yeah, over time, it can even start to fray. So which rope are we even talking about here? Let's meet the main character in this whole story, the muscle that usually takes the biggest hit with shoulder impingement.
This is the supraspinatus. It's one of the 4 essential muscles that make up your rotator cuff. Its main job? To kickstart the motion of lifting your arm up and out to the side. It also does the crucial work of keeping the ball of your arm bone perfectly centered in the socket. But, and this is key, because of its location running right through that tight tunnel we just talked about, its tendon is just incredibly vulnerable to getting pinched.
Okay, so we know what the supraspinatus does, but why does it get pinched in the first place? What's actually causing that tunnel to get so narrow?
A lot of the time, the prime suspect is a part of your shoulder blade called the acromion. Just think of it as the bony roof that sits right over your rotator cuff tendons. The thing is, for a lot of people, that roof isn't flat. It might have a natural curve or even a hook shape to it, which, as you can imagine, seriously shrinks the amount of space that tendon has to move. So why would you have a hooked acromion? Well, it really boils down to a classic case of nature versus nurture. On the nature side of things, some people are just born that way. It's in their genetics. But on the nurture side, it's something that can develop over time. Years and years of repetitive overhead movements, or even just bad posture while sitting at your desk, can cause little bone spurs to grow or ligaments to thicken, basically creating a hook and closing down that space as you get older. Okay, so we get what it is and we get why it happens. Now for the really important bit. How do you know if you have it? And what on earth can you do about it? The signs are pretty textbook. Usually, you feel the pain right in the front or on the side of your shoulder. And no surprise, it gets way worse when you do anything overhead. Sometimes, that ache can even travel down the side of your arm. And, one of the biggest clues? Pain that ramps up at night, making it almost impossible to sleep on that side. You know, a doctor or a physical therapist can often nail this down with a few simple physical tests. One of the most common ones is called the Hawkins-Kennedy test. Basically, by putting your arm in this specific position and then turning it inward, they're intentionally closing down that space in the shoulder. If doing that brings on your familiar pain, well, that's a pretty strong sign that impingement is what's going on. And here's what's so important to hear. A positive test does not mean you're on a fast track to surgery. Not at all. The evidence is overwhelming that the best place to start is with conservative, non-surgical treatments. So what's in this conservative toolkit? Well, it all starts with modifying your activities. Pretty simple, right? Just stop doing the things that hurt for a while. Physical therapy is absolutely huge, focusing on strengthening those rotator cuff muscles and getting your shoulder blades stable. Things like anti-inflammatories can help calm things down, and for really bad pain, a corticosteroid shot can offer some amazing relief. Now, if that pain just refuses to leave after, say, 3 to 6 months of really trying with the conservative stuff, then surgery can become an option. They can go in with a tiny camera, arthroscopically, and basically shave down any bone spurs to physically create more room for that tendon to do its job. But let's bring it back to what you can control. A massive part of getting better happens at home, on your own time. So let's walk through 3 core exercises that can make a huge difference. First up, scapular retractions. The goal here is simple. Fix that rounded, hunched forward posture that so many of us get from sitting at computers. Just by gently squeezing your shoulder blades down and back, you literally open up the front of your shoulder. You're creating more space right where that pinch is happening. It's like an instant posture reset.
Next, we've got pendulum swings. This one is all about gentle movement and decompressing the joint. By letting your arm just hang loose and letting gravity do the work, you're creating a tiny bit of space in there, which can take the pressure right off that pinched tendon. It's a super safe way to keep things moving, especially in the early stages.
And finally, the crossbody stretch. You might not realize it, but tightness in the back of your shoulder can actually shove the head of your arm bone forward, making that pinch in the front even worse. This stretch hits that exact tightness, helping you get more flexible and bringing some much-needed balance back to the joint.
Now this is, without a doubt, the single most important rule. Listen to your body. A nice, gentle stretch is great. Short pain is bad. If anything you're doing makes the pain worse, you stop, period, and you go talk to a professional.
So, the big takeaway here is this. You have so much more power over this than you might think. These exercises aren't just about a quick fix. They're about helping you change the fundamental posture and movement habits that are probably causing the problem in the first place.
And that really leaves us with something to chew on, doesn't it? In a world where we spend so much of our lives hunched over screens, phones, steering wheels, are we accidentally creating a future filled with chronic shoulder problems for ourselves? It's definitely something to think about the next time you feel your shoulders starting to round forward.